Top 9 symptoms of tonsils in the throat. Today, we're delving into the intricate world of tonsillitis, a common but often misunderstood condition affecting the throat. Tonsillitis, characterized by inflammation of the tonsils nestled at the back of the throat, can bring about a variety of discomforting symptoms that impact daily life. In this video, we'll explore the nuances of tonsillitis, unraveling its definition and shedding light on its diverse array of symptoms. From the classic sore throat and difficulty swallowing to the telltale signs of swollen tonsils, we'll dissect each symptom's significance in the diagnosis and management of tonsillitis. Join us as we demystify tonsils and shed light on their vital role in protecting our body from infections and illnesses. By understanding the manifestations of tonsillitis, we equip ourselves with the knowledge needed to recognize, address, and ultimately overcome this common ailment. Stay tuned for valuable insights and practical tips on identifying and managing tonsillitis symptoms effectively. Let's dive in. Number 1. Sore throat. Sore throat, the hallmark symptom of tonsillitis, results from inflammation and swelling of the tonsils due to infection, typically by viruses or bacteria. The tonsils, located at the back of the throat, are part of the body's immune system, helping to trap and fight off pathogens that enter through the mouth and nose. When these pathogens overwhelm the tonsils' defenses, they become inflamed, leading to discomfort and pain in the throat. The soreness experienced during tonsillitis stems from the body's immune response, which triggers the release of inflammatory substances and recruits immune cells to combat the infection. As a result, the throat becomes irritated, tender, and painful, especially during swallowing or speaking. This discomfort can range from mild to severe, depending on the severity of the infection and the individual's immune response. Recognizing sore throat as a primary symptom of tonsillitis prompts individuals to seek medical attention for proper diagnosis and treatment, which may include rest, fluids, pain relievers, and in some cases, antibiotics. Early intervention can help alleviate symptoms and prevent complications associated with tonsillitis. Number 2. Difficulty swallowing. Difficulty swallowing is a common symptom of tonsillitis, primarily due to the swelling and inflammation of the tonsils and surrounding tissues. When the tonsils become infected, they often enlarge and may obstruct the throat, making swallowing painful and challenging. The inflammation of the tonsils can cause a sensation of obstruction or discomfort in the throat, making it difficult for food and liquids to pass through smoothly. Individuals with tonsillitis may experience a constant sensation of something stuck in their throat, leading to discomfort and reluctance to eat or drink. The severity of difficulty swallowing can vary depending on the extent of inflammation and swelling of the tonsils. In some cases, swallowing may be mildly uncomfortable, while in others, it can be extremely painful and nearly impossible. Recognizing difficulty swallowing as a symptom of tonsillitis is crucial for prompt diagnosis and treatment. Addressing the underlying infection can help alleviate swelling and discomfort, restoring normal swallowing function and promoting overall recovery. Number 3. Swollen tonsils. Swollen tonsils are a key symptom of tonsillitis, indicating inflammation and infection of the tonsils. The tonsils are part of the body's immune system, serving as a barrier against pathogens that enter through the mouth and nose. When the tonsils encounter an infection, such as from viruses or bacteria, they become inflamed and swell as they work to trap and fight off the invading pathogens. Swollen tonsils can be visually identified as enlarged, red, and sometimes covered with white or yellow patches, indicating the presence of pus or debris. The swelling can cause discomfort and pain, particularly when swallowing or speaking. In severe cases, swollen tonsils may partially obstruct the throat, leading to difficulty breathing or sleeping. Recognizing swollen tonsils as a symptom of tonsillitis is important for seeking medical attention and receiving appropriate treatment. Management may include rest, hydration, pain relief, and antibiotics. If the infection is bacterial, addressing the underlying cause of swollen tonsils can help alleviate discomfort and promote recovery. Number 4. Fever. Fever is a common symptom associated with tonsillitis, indicating the body's immune response to infection. The tonsils become inflamed and infected, whether by viruses like the common cold or bacteria such as streptococcus. The immune system activates to combat the invading pathogens. As part of this response, the body may raise its temperature, resulting in fever. Fever serves as a natural defense mechanism, as many pathogens are sensitive to higher temperatures. It also activates the immune system, aiding in the production of antibodies and white blood cells to fight off the infection more effectively. In tonsillitis, fever often accompanies other symptoms such as sore throat, swollen tonsils, and fatigue. Monitoring body temperature can help individuals gauge the severity of the infection and determine when to seek medical attention. Addressing fever associated with tonsillitis typically involves rest, hydration, and over-the-counter medications such as acetaminophen or ibuprofen to reduce fever and discomfort. In some cases, antibiotics may be prescribed if the infection is bacterial. Number 5. Bad breath. Bad breath, also known as halitosis, can be a symptom of tonsillitis due to the presence of bacteria and debris in the throat. The tonsils become inflamed and infected. They can harbor bacteria and trap food particles, leading to the development of foul-smelling breath. The accumulation of bacteria and debris in the throat creates an environment conducive to the growth of odor-producing microbes. Additionally, the inflammation and swelling of the tonsils can contribute to the retention of bacteria and debris, exacerbating bad breath. Furthermore, the presence of pus or white or yellow patches on the surface of the tonsils, which are common in tonsillitis, can emit unpleasant odors. Recognizing bad breath as a symptom of tonsillitis underscores the importance of seeking medical evaluation and treatment. Addressing the underlying infection can help alleviate bad breath and promote oral health. Treatment may include antibiotics, gargling with salt water, and maintaining good oral hygiene practices. Number 6. Ear pain. Ear pain can be a symptom associated with tonsillitis due to the shared nerve pathways between the throat and ears. In tonsillitis, the inflammation and swelling of the tonsils can lead to referred pain, where discomfort originating in the throat radiates to the ears. The tonsils and the ears share sensory nerves, particularly branches of the glossopharyngeal and vagus nerves, which transmit signals of pain and discomfort. When the tonsils become inflamed and swollen, these nerves can become irritated, causing pain that is perceived in the ears. Additionally, the close proximity of the tonsils to the eustachian tubes, which connect the throat to the middle ear, can further contribute to the transmission of pain to the ears in cases of tonsillitis. Recognizing ear pain as a symptom of tonsillitis highlights the interconnectedness of the throat and ears, and underscores the importance of seeking medical attention for proper diagnosis and treatment. Addressing the underlying infection can help alleviate ear pain and promote overall recovery. Number 7. Voice changes. Voice changes can occur as a symptom of tonsillitis due to the inflammation and swelling of the throat tissues, including the tonsils. The vocal cords, located in the larynx voice box, can be indirectly affected by the inflammation and swelling in the surrounding areas. When the tonsils become infected and inflamed, they can obstruct the normal passage of air through the throat. This obstruction can alter the resonance and vibration of the vocal cords, leading to changes in voice quality and pitch. Individuals with tonsillitis may experience hoarseness, raspiness, or a change in the pitch of their voice. The severity of voice changes can vary depending on the extent of inflammation and swelling of the tonsils. Recognizing voice changes as a symptom of tonsillitis emphasizes the importance of seeking medical evaluation and treatment. Addressing the underlying infection and inflammation can help alleviate voice changes and promote recovery of normal voice function. Number 8. Headache. Headache can accompany tonsillitis as a result of the body's immune response to infection. The inflammatory process triggered by the presence of pathogens in the tonsils can lead to the release of cytokines and other inflammatory mediators. These substances can cause dilation of blood vessels in the surrounding tissues, including the head and neck, resulting in headache. Additionally, the discomfort and pain associated with sore throat and swollen tonsils can contribute to tension and stress, which may further exacerbate headache symptoms. Furthermore, fever, which is common in tonsillitis, can also contribute to headache. Elevated body temperature can lead to dehydration and increased metabolic demand, potentially triggering headache. Recognizing headache as a symptom of tonsillitis underscores the importance of seeking medical attention for proper diagnosis and treatment. Addressing the underlying infection and inflammation can help alleviate headache and promote overall recovery. Treatment may include rest, hydration, pain relievers, and antibiotics if necessary. Number 9. Fatigue. Fatigue is often experienced by individuals with tonsillitis as the body's immune system works to combat the infection. The immune response triggered by the presence of pathogens in the tonsils requires a significant amount of energy and resources, leading to feelings of tiredness and exhaustion. During tonsillitis, the body redirects energy towards fighting off the infection, which can leave individuals feeling fatigued and run down. Fever, a common symptom of tonsillitis, can also contribute to feelings of fatigue, as the body works to raise its temperature to combat the invading pathogens. Furthermore, disrupted sleep patterns due to discomfort from sore throat and swollen tonsils can exacerbate feelings of fatigue and lead to daytime sleepiness. Recognizing fatigue as a symptom of tonsillitis highlights the importance of rest and self-care during illness. Seeking medical attention for proper diagnosis and treatment can help alleviate symptoms and promote recovery. Treatment may include rest, hydration, pain relief, and antibiotics if necessary. Summary. In this comprehensive exploration, we've delved into the intricate world of tonsillitis, a common condition characterized by inflammation of the tonsils located at the back of the throat. From defining tonsillitis to unraveling its diverse array of symptoms, we've shed light on the complexities of this often misunderstood ailment. We began by dissecting the anatomy and function of tonsils, highlighting their role as vital components of our immune system. Understanding the significance of tonsils paved the way for exploring the symptoms of tonsillitis, ranging from the classic sore throat and difficulty swallowing to the unexpected companionship of bad breath, ear pain, headache, and fatigue. By recognizing these symptoms, individuals can seek timely medical attention, facilitating effective diagnosis and management of tonsillitis. Armed with knowledge about tonsillitis symptoms, viewers are empowered to take proactive steps in maintaining their throat health and overall well-being. Join us in our mission to demystify tonsillitis, one symptom at a time, and stay tuned for more valuable insights on navigating common health issues with confidence and clarity. Remember, understanding is the first step toward healing.